had a number of questions come in this week. One of the questions that came in was kind of an interesting one. He said, why do I need testosterone? My doctor says I'm good. That is an interesting question, and I think a lot of people hear the same response. I've heard that from multiple patients. You go into your doctor, you see them, they say, oh, you're good, you're fine, you don't need any testosterone. And most people, when they think about testosterone, especially men, they think about libido, they think about sex drive, they think about ED, and they think about testosterone. The interesting thing is that is the tip of the iceberg that testosterone, or what testosterone actually does. The other part of what testosterone does is vast, it's huge. The testosterone, when you take it, will convert into estradiol and convert into dihydrotestosterone. Now, what they're finding is that testosterone does way more than just increase your libido or strengthen your erections. What it does is it decreases coronary artery disease. How does it do that? It does it by decreasing heart attacks, by decreasing strokes. Multiple journal articles and studies have been done that show decreased heart attacks, decreased strokes. It also, as you get older, you start utilizing your glucose less efficiently. You may become insulin resistant. You hear that term quite a bit these days. What testosterone will do is it will help you utilize your glucose more efficiently in your body, so you become less insulin resistant. It also, in terms of protection, as far as protection, it helps you with giving you stronger bones so that you don't get osteoporosis. It actually prevents it and can delay it from coming. The other thing that testosterone does do, there are studies out there that shows that it prevents or delays Alzheimer's disease. Think about it. We're giving you testosterone levels back to where you were in your 20s and 30s. How many 20-year-olds, how many 30-year-olds do you know that have heart attacks or that have strokes? Very few. And so the interesting thing about testosterone does so many more things. It also improves your cholesterol and your lipid levels. It helps with arthritis, helps with neurological diseases. It helps with depression. I have a number of men who have been on SSRIs throughout the years, maybe with minimal results. They don't see where they get the benefit of the SSRIs that they want, but when I put them on testosterone, it's like boom. They start feeling better, they have the energy back, they have that pep back in their step, and overall it just helps with that depression. It helps with weight loss. It may not help with weight loss like in 2 weeks, but long term, over a period of time, you will see weight loss. It helps with concentration, with your libido, with your erectile dysfunction. One of the interesting things is men will typically get to the point where they go into their doctor and they muster up the courage and say, hey, I want one of those little blue pills. And the doctor willingly gives it to them, no problem. And I don't have a problem with that. But the interesting thing is 95% of those doctors don't examine why he's having ED in the first place. A large percentage of those patients with ED actually have low testosterone. And if you treat the testosterone, guess what? Everything else is going to work good. So when you look at just testosterone and you think, oh, it's just for libido, oh, it's just for ED, it does a whole lot more than that. Every man over 45 should get their testosterone levels checked. The nice thing about testosterone, it's an easy test, it's a blood test. You can get done with most of your other labs that you have. Most people don't do it. But today, I think the interesting thing with his question was, we hear it so often, oh, you don't need it, you're good. Don't worry about it. Well, you do need to worry about it. These levels can help protect, they can keep you alive, they can keep you healthier, where you can enjoy your family, your job, your friends, and live a better life.